It's a talk in which the focus is slightly different from the focus of the majority of the talks about the role of MRD in myeloma, which is mostly as a prognostic factor and eventually, in the future, as a biomarker to help on treatment decisions, accelerating drug approval. Tomorrow we will tackle the MRD from a different angle, which is again more about the biology, both of the tumor cell, the chemo-resistant MRD clone, as well as the microenvironment and the other immune effector cells. At the MRD level, the tumor chemo-resistant clone, we want now to study its biology for two reasons. One, to understand the mechanisms of ultra-chemoresistance, and if by understanding them, if we can develop novel targets, if we can identify novel targets, develop novel therapies or new therapeutic combinations in order to eradicate MRD cells. This would have a crucial impact. And also to understand the biology, the genetic features of the MRD clone, to understand if in some patients you might have MRD, but the biology, the genetics of the MRD clone, they resemble an MGUS-like clone. And if it is an MGUS-like clone, then the patient might actually be MRD positive, but be progression-free for 5, 10 or more years. These are not the majority of patients, they might be a minority, but it's equally important to prospectively identify those patients. Then outside of the MRD cell, now focusing on the microenvironment, to study now in more detail with high throughput technologies, both cellular as well as molecular technologies, the role of the immune system in controlling persistent levels of MRD. Particularly now in the era of immuno-oncology, we believe it's critical to perform both in parallel and to study at the same time the immune system and understand what is the role of the immune system in really controlling the residual disease.